back. This is Health Matters with me, Dishen Kumar, and today's topic is lung cancer, and with me is Dr. To. So Dr. To, we had a very interesting conversation. We have switched our location now because we're going to go into very serious discussion. First of all, I think question on even my mind when I talk about lung cancer is the mortality rate.
Right.
How is the mortality rate, or if a person gets lung cancer, what are the chances they can survive?
So it's not good news. Lung cancer compared to other types of cancer has the worst survival rate in Malaysian statistics. So lung cancer, 1 out of every 4 cancer deaths in Malaysia is caused by lung cancer. Lung cancer kills more people than breast, colon, and prostate cancer combined.
Wow.
So that's the bad news. The good news is we have many more exciting and new breakthroughs in terms of treatments that I'm sure we'll talk about.
Okay, so talking about treatment, what are the types of treatments that is there currently, and any new treatments out there now?
So the type of treatment for lung cancer depends on our genetic analysis of the tumor. So in terms of the previous ways we've looked at it, we've not tended to look at the genetics. Now it is absolutely essential. So when we do the biopsy for the patients, we look at what genetic components are in the tumors. So we can give them either smart bombs or targeted therapies, treatments which just hone down and kill the tumor cells. And for stage 4 patients, we used to expect survival rates of about 6 months, we now can get survival rates for about 2 to 5 years, or even longer.
Yeah, that's a huge increase.
The longest patient I've had on targeted therapy is 8 years.
8 years,
and this is a huge difference from 20 years ago, which was just 6 months.
Oh, wow, okay.
The other exciting breakthrough in lung cancer is, of course, immunotherapy.
All right.
So immunotherapy is a drug that's designed to boost our immune system so that our own immune system can start fighting the cancer cells and kill these cancer cells. Again, we are seeing patients who have had very long-lasting and excellent responses to immunotherapy in stage 4. And the latest way we are doing it is combining this immunotherapy with chemotherapy to boost the effect, and we've seen excellent results with that as well.
So not only treating the patient with chemotherapy, but also using immunotherapy as a double whammy, as they can say.
So you're actually modifying our immune system such that our immune system can now detect the cancer cells when they emerge and kill them. So this is like what we say, sending a sniper into the jungle, letting him hide there, and wherever enemy emerges, just shooting him off. So that slow burn kill of the cancer cells.
Okay, so it's not all bad news for people who have lung cancer. But talking about the stage 1 to stage 4, are there different types of treatments, or is it very targeted in stage 4, or is it very targeted in stage 1, or things like that?
So unfortunately, most of the patients in Malaysia, about 3/4, are diagnosed at stage 3B or 4, which is not curable. So what of the treatments I've spoken to you about are targeted towards that group. Only a minority, 20 to 25%, when they first see us, are what we consider curable. So if it's stage 1 or 2, surgery tends to be the mainstay of our treatment. So to go in actually removing it. If the surgeon can't remove it, then we give it radiotherapy to blast it away. And that is also what we do in stage 3. We use radiotherapy plus immunotherapy and chemotherapy with an aim to cure the patient.
Okay. Now talking about the stage 1 and stage 2, something interesting that I've even talked about when I go out and do all these shows, talking to doctors and things like that about cancer, is there isn't a sure way of telling someone that the cancer may not come back.
Yes.
There's always a chance for cancer to come back. So about when a person gets cancer, maybe stage 1 and stage 2, especially lung cancer, is there a lot of lifestyle changes that they have to do? Because you can quit smoking, yes, but is there other steps that they can take, not only in the quit smoking, they actually can increase their chances not to actually get cancer?
So I think once you're diagnosed with cancer, you automatically go onto a follow-up program. So where we doctors will do scans regularly to check you up for at least 5 years. So once you're over that 5 years, we tend to use the word cure, or at least say that you're in remission.
Okay.
It is absolutely imperative to change your lifestyle once you have a diagnosis of cancer. And what has been proven to be effective is to stop smoking, to lead a healthy lifestyle, which includes a healthy diet, exercise, sleep well, less stress, and so on and so forth, mainly to make sure your immune system is strong, so that these cancer cells that come up can be killed by your own immune system.
Okay. Now, they've done all that. For a person who is going through treatment, it's chemotherapy, immunotherapy, you're saying. Is there any side effects for that treatment as such?
Yes, I think every treatment potentially may incur some side effects. But I think with modern cancer treatment, we tend to limit these side effects to the absolute minimal. So chemotherapy today, for example, is not the same as chemotherapy as it was 10, 20 years ago, where you had hair loss, vomiting, you couldn't get out of your house. Patients undergoing chemotherapy these days actually, after 2-3 days, get back to work, go out, look after their families. The treatments are designed to allow patients to carry on life as normal as possible. What we know is immunotherapy, which seems to be more effective than chemotherapy in many circumstances, have even less side effects. And patients are even much better in terms of how they feel, and they're able to carry on with their day-to-day life.
So immunotherapy, you're talking about there's less side effects, but what are the side effects that a patient may experience if they do immunotherapy?
So patients on immunotherapy may experience a little bit of tiredness, and that's quite common, but that's bearable. Perhaps the one thing that that patients on immunotherapy are at risk of is, in fact, we improve the immune system to such a high extent that our immune system is so strong that it may start to attack some of your own cells in your own body.
Oh, wow.
So for example, the lung or the liver and so forth. But the good thing is if we detect it early, we are able to suppress that down with medications, and patients are normally quite okay after that.
Okay. So doctor, I have to ask you, put you on the spot here a bit. We talked about lung cancer, we talked about it's one of the most prominent cancer in Malaysia for men, and smoking is one of the main causes of it. What would be your advice for people watching this right now? They might be watching this even with a cigarette in their hand.
Okay.
What would be your advice for smokers in Malaysia?
My advice is put that cigarette down, get out, breathe some fresh air, exercise, eat well, more vegetables, less fried stuff and healthy stuff.
Okay. Do you have anything you have to say about people who think they need to check with their doctors, or they're having some symptoms and things like that?
I think if you have symptoms that what we talked about earlier, coughing or coughing out of blood, unexplained weight loss, pain in the chest, which is again unexplained, that doesn't go away with a simple treatment like antibiotics, definitely go and get it checked out with your specialist or your GP to explain your concerns. And I think most probably you'll need some investigations like a chest x-ray. Early detection is always the best. There's a cure for lung cancer, and people live long if we manage to detect them early and cure them.
All right. Thank you so much, doctor, for your time. Now, that has been Health Matters. This is today's episode. We talked about lung cancer, we talked about smoking, we talked about what these guys can do to you. And one thing that I can take away from this episode is maybe it's time to quit. This is Health Matters. I'll see you in the next episode. Goodbye.